I'm Sheena Larson, and this is Michelle. She's helping me with Bobby here. He's here for a neuter. We are going to be pre-medding him with acepromazine and hydromorphone. Acepromazine is a phenothiazine derivative. It doesn't have any analgesic properties, but it's going to be used for sedation and to reduce some of his anxiety. As you can see, he's a very excitable, friendly dog. Acepromazine also has antiemetic properties and antiarrhythmic properties to smooth anything that might happen during the anesthetic. It is also a vasodilator, so we may notice a drop in his blood pressure. I didn't actually take his blood pressure, but I'm going to assume that it's quite high. His temperature was quite high. It was 39.2. His heart rate was 162 beats per minute with strong pulses, no deficits. His rest rate was 48 beats per minute. Looks like it might be a little bit higher now that he's panting. Getting all excited. But no abnormal heart sounds. His mucous membranes here are a nice bright pink. They're moist. His CRT was less than 2 seconds. So he's a nice, happy, healthy boy. So anyways, back to what we might see. His temperature will probably go down because of the vasodilation effects, and his blood pressure will probably drop. So we'll see potential hypotension. Also, his nictitating membranes or third eyelids might elevate. Whereas like right now, if we can go past his little mop, you can see that they're not currently elevated. And the one thing with acepromazine is that the effects can be quite long lasting and it's not reversible. For the hydromorphone, that's where we get a bit of our analgesia to offset some of the pre-surgical pain. It is an opioid. It is a full mu agonist. It also causes sedation, and it can cause respiratory depression. So we'll see his breathing calm down. We're going quite a low dose, so hopefully it won't be too extreme. And then also some bradycardia, and it can cause some vomiting or constipation if it was to be used long term. In cats, if we were using it, we might even see hyperthermia. And then, And then I also forgot to mention for the acepromazine, there are certain dogs that are more susceptible to their effects. Like, so dogs with the MDR1 gene might be more susceptible. So I am just going to be administering his pre-med now that we determined that he is healthy. And this is one of my clinical mentors here, Dr. Dickinson. So I'm just going to go into the epaxial. So I'm going to find the point of his hip, and then using an appropriate sized needle, find his spine. Michelle's just holding him securely because he might not like this. Make sure that I can feel the muscle group right here. And then I'm just going to inject, not draw back to make sure that I'm not getting any blood or anything. And it's a bit painful. So this is Bobby 15 minutes after the pre-medication had been administered. So as you can see, he is a lot more sedate than he was before. He's not completely out of it, but he's definitely a lot slower. Also, we have definitely noticed some of the effects of the drugs. He had vomited in his kennel, which is probably a result of the hydromorphone. And then the ace-promazine didn't bring his nictitating membranes up like we would have expected, but it was a low dose. And then we did see bradycardia from the hydromorphone. Or not full bradycardia, but his heart rate definitely slowed down. His heart rate went from 164 down to 100 beats per minute, and the vasodilating effects of the ace-promazine was also visible. We didn't take his temperature or his pressure, but I am going to assume that it's lower than it was before because he's a lot more relaxed. But his temperature has also gone down from 39.2 degrees Celsius to 38.9. And then his breast rate actually increased. He had started panting, which is something that we see with hydromorphone. So we sometimes see respiratory depression, and as we go on, his breathing might slow as he becomes more relaxed. But right now, he is in a state where we would be ready to intubate, prepared to induce and intubate. Yeah.